Hello friends, welcome to another interesting educational session of Manju's Testimony. Today in this video we are going to discuss a few confusing reading questions part. I included 3 questions for which the options are a bit confusing. You can easily eliminate one of the options, but you may get confused in between the other 2 options. I will explain the reason behind both the right and wrong answers. If you have any doubt in between, kindly ask in the comment section. And if you need the reading material, send me a message in Telegram. Get my Telegram link from the channel description. I will send you the reading material. And if you haven't subscribed to my channel, kindly do like, share and subscribe. And press the bell icon so that you will get all the notifications when I upload my videos. Okay, so let's start the video without any delay. As I explained in my previous videos, I recommend you to read the options first before going to read the text in part B reading. This is because sometimes by reading options we can understand some of the keywords to find out the answers from the text. So this way you can save the time. But it is not always possible in part B because sometimes the question need us to understand the entire meaning of the text. So in this case, you need to read the entire text to find out the answers, but some of the questions you will get the answers from the keyword as well. So I will read you these questions, and I recommend you to pause the video after each questions and trying to find out the answer by yourself. Okay, so let's read the question now. As explained in the protocol, the position of the arium container will ideally: option A, encourage participation in the scheme; option B, emphasize the value of recycling; and option C, facilitate public access to it. So, unwanted medicine pharmacy collection protocol. A returned unwanted medicine RUM project approved container will be delivered by the wholesaler to the participating pharmacy. The container is to be kept in a section of the dispensary or in a room or enclosure in the pharmacy to which the public does not have access. So this paragraph is talking about the position of the RUM container. Okay. The container may be placed in a visible position but out of reach of the public, as this will reinforce the message that unwanted prescription drugs can be returned to the pharmacy and that the returned medicine will not be recycled. So the next paragraph is needles, other sharps and liquid cytotoxic products should not be. So that sentence doesn't have any purpose in this question. So possibly our answer will be in the second paragraph. So let's read the question again. As explained in the protocol, the position of the RUM container will ideally: option A, encourage participation in the scheme. This paragraph does not apparently say anything about participation in the scheme, right? No keywords like encourage the public. There is no synonym for participation or encouragement in the second paragraphs. So in this case, let's keep that question aside and let's go for the next option. Option B, emphasize the value of recycling. Yes, we have found this word recycling somewhere in the paragraph. The container may be placed in a visible position but out of reach of the public, as this will reinforce the message that unwanted prescription drugs can be returned to the pharmacy and that the returned medicine will not be recycled. So what is the meaning of this sentence? So it says that the container, RUM container, should be placed in a way, in an area. So the area is already explained in the first sentence, in a room or enclosure in the pharmacy to which the public does not have access. So the container may be placed in a visible position. The container should be placed in a position which is visible to the public, but the public should not have access to it. Okay. This will reinforce the message that unwanted prescription drugs can be returned to the pharmacy. So by doing so, by placing the container in a visible position of the public, will enhance the public thought that their unwanted medicines can be returned to the pharmacy and these medicines will not be recycled. These medicines will not be recycled. So what is mentioned in the option B, emphasize the value of recycling. It says that it emphasizes the value of recycling. That means it's positively support the fact of recycling. But the paragraph says that it helps the public to become aware that the medicines which return to the pharmacy will not be recycled in any way. Okay. So option B is wrong. Option B is straight opposite to the paragraph. The next option is option C, facilitate public access to it. Option C can be easily misinterpreted as the right answer, but this is not the right answer because facilitate public access to it. There is the keyword public and access. We have seen the same keywords in the paragraph as well. But what the paragraph says is the container should be placed in a position which should not have public access, but it should have the public visibility. The public can view the container, but they cannot get access to it. Okay, so the option C says that it facilitate means it positively support the public access, but the position of the container does not allow the public to get access. Okay, so we eliminated two options, option B and C, and now the answer is option A. But I will explain you how option A became the answer. Encourage participation in this scheme. So in the second paragraph, they explained that the RUM container should be placed in a position where the public can view it, but they cannot access to it. Why do we kept this RUM container like this? Because it will reinforce the message that unwanted prescription drugs can be returned to the pharmacy and that the returned medicine will not be recycled. So by doing so, or by placing this RUM container in a way, in such a position, will encourage or will help the public to get aware that these medications can be returned to the pharmacy and it will not be recycled. That means it will encourage their participation in the scheme, right? They will return their unwanted medicine to the pharmacy. This way the pharmacy or the authority can encourage the public to participate in the scheme. Okay, so I hope you understood what I have explained, and now let's go to the second question. The report mentioned in the memo suggests that, so I already told you sometimes we may have to read the text completely to understand the meaning. So in most of the cases, in memos and reports, it is like that we have to read the text completely to understand the meaning. Okay, the option A is data about the patient error may be incomplete. Option B is errors by hospital staff can often go unreported. Option C, errors in prescription pose the greatest threat to patients. Okay, so just let's notice the keywords in the question. The report mentioned in the memo suggests that the options data about patient error may be incomplete. Okay, data about patient error may be incomplete. Errors by hospital staff can often go unreported. Errors in prescription pose the greatest threat. Errors in prescription pose the greatest threat to patients. Okay, so let's read the memo. Report on oral anti-cancer medications. Nurse unit managers are directed to review their system for the administration of oral anti-cancer drugs and the reporting of drug errors. Serious concerns have been raised in a recent report drawing on a national survey of pharmacists. Please note the following paragraph quoted for the report. Okay, incorrect dose of oral anti-cancer medicines can have fatal consequences. Over the previous 4 years, there were 3 deaths and 400 patient safety issues involving oral anti-cancer medicines. Half of the reports concerned the wrong dosage frequency, quantity or duration of oral anti-cancer treatment. Of further concern is that errors on the part of the patient may be underreported. In light of this report, there is clearly a need for improved system covering the management of patients receiving oral therapies. Okay, so we have seen some of the words there in the options in the text, right? So now look again the text for the answer. Okay, option A, data about the patient error may be incomplete. Data about patient error. Okay, where was the patient error mentioned? Or further concern is that the errors on the part of the patient may be underreported. Okay, so this sentence has a similar meaning of option A. Data about patient error may be incomplete. Data about patient error may be incomplete. So that's rephrased here. Is that errors on part of the patient may be underreported. So if it is underreported, that means it is not complete. Some of the patients not reporting the error. So that means that this is underreported, incomplete. So we can just keep the option. The next option is error by hospital staff can often go unreported. We did not see any sentence here which was saying that hospital staff errors are underreported. We have seen that the patients, from the error reporting from the patient side was underreported, but there was no sentence say anything about RSY hospital staff goes unreported. Okay, so the next option C, errors in prescription pose the greatest threat to patients. First sentence, I mean the sentence of the first sentence of the last paragraph says that incorrect dose of oral anti-cancer medicines can have fatal consequences. Over the previous 4 years, there were 3 deaths and 400 patient safety issues involving oral anti-cancer medicines. Half of the reports concerned the wrong dosage, frequency, quantity, or duration of oral anti-cancer treatment. Some candidates may assume that this wrong dosage and frequency is concerned with prescription. We are not allowed to assume any answers from Oet reading. We have to understand only what is mentioned in the text. We cannot find out the answers by using our medical knowledge. Okay, so here the answer is data about patient error may be incomplete. This is the right answer. We eliminated option B and option C. Option C is not apparently evident from the paragraph and we cannot assume anything. So this is the reason why option A became the answer for this question. Okay, so let's move on to the last question. What point does the training manual make about anesthesia workstation? Option A, part of the equipment have been shown to be vulnerable to failure. Option B, there are several ways of ensuring that the ventilator is working effectively. And option C, monitoring by health professionals is a reliable way to maintain patient safety. This question maybe help us to find out the answers with keyword. So let's check for the keywords now. What point does the training manual make about what point? We are going to find out what point does the training manual make about anesthesia workstations. Okay. Option A, part of the equipment have been shown to be vulnerable to failure. Part of the equipment vulnerable to failure. Option B, there are several ways of ensuring that the ventilator is working effectively. Several ways ventilator is working effectively. Option C, monitoring by health professional. Monitoring by health professional is a reliable way to maintain patient safety. Is a reliable way to maintain patient safety. So let's read the text now. Anesthesia workstation. Studies on safety in anesthesia have documented that human vigilance alone is inadequate to ensure patient safety and have underscored the importance of monitoring devices. These findings are reflected in improved standard for equipment design, guideline for patient monitoring, and reduced malpractice premium for the usage of capnography and pulse oximetry during anesthesia. Anesthesia workstations integrate ventilator technology with the patient monitors and alarm to help prevent patient injury in the unlikely event of ventilator failure. Furthermore, since the reservoir bag is part of the circuit during mechanical ventilation, the visible movement of the reservoir bag is confirmation that the ventilator is functioning. So what is the entire meaning of the text? So it is talking about anesthesia workstation. So only human or healthcare professionals monitoring is not adequate to maintain the safety of the patient. The ventilator should be associated with another monitoring equipments to ensure the safety of the patient. For example, patient monitors and alarms to help prevent patient injury in the unlikely event of a ventilator failure. They also emphasize the importance of connecting a reservoir back to the ventilator circuit so that we can understand the ventilator is functioning by noticing the movement of this reservoir bag. Okay, so this entire paragraph is talking about the importance of monitoring devices in an anesthesia workstation. So option A, part of the equipment have been shown to be vulnerable to failure. We may misunderstand that this is the answer because the entire paragraph is talking about a ventilator dysfunctioning and the importance of connecting monitoring devices to ventilator to easily identify the malfunction. Okay, so in other words, we can say the parts of the ventilator or the ventilator itself can be malfunction. So this may be an answer, or we may think that this may be an answer, so that's why we can just keep it standby. We are not eliminating the option A now. Let's see option B. There are several ways of ensuring that the ventilator is working effectively. We have seen so many options here in the text, like anesthesia workstation integrate ventilator technology with the patient monitor and alarm to help prevent patient injury in the unlikely event of a ventilator failure. So this sentence is talking about the importance of monitors and alarm to prevent the patient injury in case of a ventilator failure. Furthermore, since the reservoir bag is a part of the circuit during mechanical ventilation, the visible movement. So visible movement of the reservoir bag is also a confirmation that the ventilator is functioning. That means there are several ways of ensuring that the ventilator is working effectively. So this may be the answer. So just keep it. Let's see the option C. Monitoring by health professionals is a reliable way to maintain patient safety. This is not the right option because it is easily understand from the first sentence that studies on safety in anesthesia have documented that human vigilance alone is inadequate to ensure patient safety. The option says that monitoring by health professional is a reliable way to maintain patient safety. Reliable means we can believe or it's okay. The health professional monitoring is enough to ensure the safety of ventilator patients, but the studies on safety in anesthesia have documented that human vigilance is not adequate, it is inadequate. So the option C is opposite to what says in the text, so we can easily eliminate option C. Now we have option A and option B. For the option B, we understood that this is clearly the right thing what the text say about, but option A, part of the equipment have been shown to be vulnerable to failure. We can assume that the ventilator can be malfunctioned and the monitoring devices would help to understand or identify the ventilator malfunctioning, but no sentence in the text says that any part of the equipment have been shown to be vulnerable to failure. Did you see any sentence say in particular that any parts of the equipment have been shown to be vulnerable to failure? It says that monitoring and alarms to help prevent patient injury in the unlikely event of a ventilator failure. But that doesn't mean that the text strictly says that a part of the equipment have been shown to be vulnerable to failure. Nothing. Unlikely event of ventilator failure. If it happens, these monitors will help to identify the ventilator failure. But that doesn't mean that option A is the right answer. So now we got the right answer. The right answer is option B. So friends, that's all about today's video. We completed 3 questions. If you have any doubts, as I told you, just mention your doubts in the comment section. Reach out to me in the Telegram to get the materials, and I wish you all the very best for your exam. We'll see you in the next video soon. Till then, bye.